So emotionally, they don't want to be there. So guess what they're looking for? Reasons to not. And when you are talking to them, you're in a space of, I understand what's going on. The logical fix is this. Let's just do this. And it speaks to their emotional brain and they go, I'm out of here. Hello, and welcome to another episode of the Physician Growth Accelerator, a show where we break down your medical practice vitals into systems, give you the tools to diagnose root cause, and most importantly, prescribe what to do about it. I'm your host, Zed Williamson, and I believe that every system is perfectly designed to get the result it gets. In business, this statement brings you freedom. It brings you the opportunity to change the outcome you want to get. So imagine the thing that you don't like, this result that's happening within your business, own it. It's the perfect outcome of a system designed to create it. Once we say that, once we wrap our heads around this concept, then we can go into that system, identify what needs to be tweaked, tweak it, and get the result we want. Now today, we're going to talk about something, and it has to do with practice to patient communication, meaning people within the practice, with the patient in the practice, and that back and forth that happens, whether it's staff, physician, surgeon, all around. Now, you might believe that humans make decisions logically. If you believe that, that's fine. That's your perspective. Just know it's factually incorrect. Okay. So as humans, we make decisions with emotion. We come back and justify it with logic. Now, why does that matter? Well, imagine your busy practice and you have patients coming to you. So in a logical world, if they were all Spock from Star Trek, then they would recognize that they have a problem. They would show up and say, I have this problem. I would like it fixed. You would say, we've identified the root cause. Here is the fix. And they'd say, let's do that. And 100% of patients would move forward with treatment. But we're not logical. And so many things influence whether or not a patient moves forward. A lot of it is how you talk to them. And the reason is you're coming at it from an angle of expertise, which does not help you communicate to a patient. And that's referred to as the curse of knowledge. For a visual, imagine a gigantic oak tree with roots that spread deep through the ground. And you are that oak tree. So you have this huge foundation of understanding. Your branches can spread way out. The tree can support them. When you talk to a patient, you're basically handing one of those branches to them. They don't have the foundation. They can't support that branch. It just goes over the head and they are wiped out, which influences behavior. If we think about that patient and how they got to you, they experienced something that was negative. They probably experienced it longer than they should have. They probably talked to themselves out of going to you for weeks or months in advance. And it finally came to a head and they finally have booked an appointment. So emotionally, they don't want to be there. So guess what they're looking for? Reasons to not. And when you are talking to them, you're in a space of, I understand what's going on. The logical fix is this. Let's just do this. And it speaks to their emotional brain and they go, I'm out of here. And that's why when patients are offered solutions and just decided, so many patients will not move forward if they are just offered multiple solutions that they have to pick from. The reason is there's a specific bias around this. It's called ambiguity effect. Ambiguity effect is really interesting. It's not that we avoid something because it's confusing. That is not it at all. What it is, because it's a survival mechanism, is when ambiguity effect is in play, our brain goes worst case scenario. So if it's confusing to them, worst case scenario. Not clear? Boom, worst case scenario, they're jumping straight to it. So imagine how much that impacts whether patients book treatments and actually show up for them. That bias is a big deal. You have to be in this position where as the practice, people communicating with patients, everything that is normal to you is absolutely freaking patients out. They don't really want to tell you that. They're probably not going to ask all the questions that are in their mind, but they are getting freaked out. It took a lot of work for them to actually get into the practice, to get over all of these biases. And then what happens is the communication can feel a little logical from the medical practice, and it's hard for the patient to move forward. Are you a private practice leader dealing with team drama, growth headaches, or just trying to keep your head above water? Introducing the Physician Growth Accelerator membership, a free resource for our podcast listeners like you to get real solutions. Inside, you'll find exclusive materials, free courses, bonus podcast content, and live events, all designed to help your practice grow. It's free for now, so don't wait. Visit physiciangrowthaccelerator.com and click members to join today. There's another bias that really impacts patients at this point, and it's called omission bias. Omission bias tells us that we will avoid choosing to do something if there is any chance of a negative outcome, even if the negative outcome is significantly better than where we are today. Think about that. And then imagine if all of the communication is just very surgical to them. Well, you know you're going to have this recovery time, and this is going to be a little bit painful, and it's normal to you because you think it's a better fix for the patient, and they're having a hard time. Omission bias is grabbing it and saying, hey, let's just deal with what we're dealing with because the fix sounds miserable. And the reason why this matters is because if you have a private medical practice, this is bogging down your system. This patient is coming in because they had a need. They're taking up the time of your practice because they have a need. They should be taking up your time. And then something's happening in the communication between you or your staff and them, and it's not getting them to the point of treatment, what they actually came for. So what do we do about this? First, you can set up that first appointment in a way that really lines up the rest of their interaction to be much better. And that is understanding what their actual goal is. They may not have one, but asking them will help them think about that. Hey, let's fast forward to the end of today. What's your goal? What do you want to walk away with? Some are going to say, I don't know what's going on, so I just want to get checked out. Some will say, I'm tired of this, I want to fix. Some will say, I've been to 97 doctors, I am ready, can we go straight to surgery? But getting that understanding in advance helps you understand how to communicate with that patient. Because imagine it's I've been to 97 doctors, can we just go straight to surgery person? You never find that out. And you start them down this extraordinarily conservative path because maybe they didn't share that history with you. And in their brain, they're going, man, they're not here to fix my problem. They're just here to wring me out. Or maybe you think it's someone who's been dealing with this forever and they want to get this fixed right away. We got a minimally invasive procedure. No worries. Let's rock and roll. And they're thinking, wait a second. I didn't even know I was dealing with this until last week. It impacts the communication. So the simple understanding of what their goal is, fast forwarding to the end. And that's a way to present that question so that they don't have to make up an answer. They can actually pretend they're in the future and look at what is it that they really want to walk away with. It's a great way to structure that question. Hey, let's pretend the appointment's over. You're going home. What do you want to walk away with today? For this was really worth your time. And then there's another tactic I'm going to give you, and I refer to it as buckets. Here's what's interesting about humans. Humans are predictable, and we want to be alike others. We want to do things that people who are alike us do. And it's easier for us to answer within that group norm than just an individual answer. And so what does that look like? You could say something like, all right, you're dealing with these issues. You've been dealing with them for a while. I'm glad you've come to us. There's some options, and we're going to walk through those options with you. Typically when we see patients that are dealing with this, they tend to fall into one of two or three buckets. One is they're at the beginning of their understanding, and they just want to make sure that there's nothing really bad going on. They're not really interested in fixing anything. It's not impacting their life that much. Another bucket is it's starting to get frustrating. It's starting to impact their life, and they're starting to maybe avoid things that they love doing. And then the third bucket is they are ready. They don't want to deal with this anymore. Whatever it takes, we want it fixed now. Which bucket would you lean towards? And now the patient tells you. And so you can create your communication specific to what bucket that person has identified with. And the reason that matters is because there's a couple things that are happening underneath here from a psychological standpoint. First of all, you're stating something that allows them to say, they know what people like me go through. And, people like me have been here before. And, people like me have been treated this way before. That creates a lot of comfort. And then they can tell you how to move forward with them. The thing is, patients suffer for a long time. As humans, we tend to fade into that suffering. Our brain is saying, it's not killing us right now, so let's just put off these other things. Because I guarantee you have heard your patients say, man, I wish I would have come in sooner. That is not a surprising thing to hear. If you understand the psychology of the brain, that is not surprising at all. It's likely said by almost every patient, whether it's out loud or in their mind. So being in the medical space, you can help patients accelerate their lack of suffering. Use buckets. Tell them, hey, typically fall into one of these three. Here's what these three are. Which one do you lean towards? They will appreciate you. They'll appreciate your practice, and you'll get a better understanding of what they truly want from their interaction from your private practice. If you're ever curious about your internal system, your practice vitals, go to Physician Growth Accelerator and click on Vitals. And we'll see you again on the Physician Growth Accelerator.